about the topography and general organization of the cerebral hemisphere. In order to increase the surface area and substantially the volume, the layer of the cerebral hemisphere is thrown into fold. This fold is called of convolution called gyri, and the intervening structures between these gyri called sulci. We have different sulci and gyri, and we start to describe first the central sulcus of Roland. How we can identify the central sulcus? First of all, the central sulcus is located between two gyri, which is motor and sensory, primary motor and primary sensory area. Another point, the central sulcus even indenting the medial surface of the cerebral hemisphere at the superior border of the cerebral hemisphere. And third point, the central sulcus have two bend along its course and also forming an angle about 70 degrees with the vertical plane. So that after I identify the central sulcus, we can divide the cerebral hemisphere anterior to the central sulcus called frontal lobe and posterior to the central sulcus till the parieto-occipital sulcus called parietal lobe. Another sulcus is the lateral sulcus, or accurately speaking, the lateral fissure. This consisting of three rami, anterior rami, ascending rami, and the continuation of the lateral fissure is called the posterior rami. The area anterior to the central sulcus and superior to the lateral fissure is frontal lobe, while the area posterior to the central sulcus and superior to the lateral sulcus is called parietal lobe. On the medial surface, we can identify another sulcus, which is parieto-occipital sulcus, that meeting another sulcus, which passes from the posterior aspect of the splenium of the corpus callosum toward the occipital pole, and this sulcus is called calcarine sulcus, forming a Y-shaped configuration. Anteriorly, the parieto-occipital sulcus, or on the superior lateral aspect of the cerebral hemisphere, we can identifying the occipital lobe. Occipital lobe, that is the area or an imaginary line that join the parieto-occipital sulcus to pre-occipital notch. The pre-occipital notch is about 5 centimeters from the occipital pole. And if we take an imaginary line from this parieto-occipital sulcus and pre-occipital notch, the area posterior to it is the occipital lobe. The area inferior to the central sulcus is called temporal lobe. What are the main sulci and gyri in the frontal lobe? The frontal lobe, this is the central sulcus. As you see here, a central sulcus between two gyri, and the area anterior to the central sulcus, superior to the lateral sulcus, is called frontal lobe. All this area is frontal lobe. The main sulci and gyri in the frontal lobe, we have a pre-central sulcus, superior frontal sulcus, inferior frontal sulcus. Superior and inferior frontal sulcus. These give three gyri. Superior frontal gyrus, middle frontal gyrus, inferior frontal gyrus. Here we can see this is the superior frontal gyrus, middle frontal gyrus, and the inferior frontal gyrus. Two sulcus. This is the inferior frontal sulcus, superior frontal sulcus. Anterior to the central sulcus, precentral sulcus. Precentral sulcus and precentral gyrus. Precentral sulcus and precentral gyrus. Posterior to the central sulcus, we can see the anterior superior to the superior to the lateral sulcus is the parietal lobe. The parietal lobe containing the main sensory area or synesthetic area, and also we containing one sulcus called intraparietal sulcus. Intraparietal sulcus. This intraparietal sulcus dividing the parietal lobe into two parts, superior parietal lobule and the inferior parietal lobule. Superior parietal lobule, inferior parietal lobule. The inferior parietal lobule subdivided into supramarginal gyrus here and angular gyrus. Supramarginal, angular gyrus. Regarding the temporal lobe, containing three gyrus: superior temporal gyrus, middle temporal gyrus, and the inferior temporal gyrus by two sulcus: superior temporal sulcus and inferior temporal sulcus. Here we can see this is the area called the temporal pole. This is the frontal pole, and this is the occipital pole. So that's all about the superolateral aspect of the cerebral hemisphere. What about the medial aspect of the cerebral hemisphere? On the medial aspect, we can see it consisting of an important structure which connecting two cerebral hemisphere and regarding as a commissural part of the medullary center, and this is called corpus callosum. Corpus callosum. The corpus callosum consisting of the rostral part. This is a rostral part of the corpus callosum. Then bending part called genu, bending part, and body, and lastly the splenium part, splenium of the corpus callosum. Anterior to the corpus callosum, there is a gyrus called cingulated gyrus. Cingulated gyrus. The area between cingulate gyrus and the corpus callosum here, this is called callosal sulcus. Callosal sulcus. Also, we can see here in the anterior part the medial frontal gyrus, which is the same part of the superior frontal gyrus that is passes to the medial aspect of the cerebral hemisphere. Above the cingulated gyrus, there is a cingulate sulcus. Cingulate sulcus give paracentral sulcus and marginal sulcus. Between these two parts, there is an area of passing or the region or gyrus that passes from superolateral to the medial aspect, which include the precentral and postcentral gyrus, all forming a paracentral lobule. A paracentral lobule. The area between marginal sulcus and subparietal sulcus here, subparietal sulcus, which is a continuation of the cingulated gyrus, called pericuneus. pericuneus. All these are called pericuneus. And the area between the parieto-occipital sulcus and the calcarine sulcus called cuneus. That is all about the medial surface of the cerebral hemisphere. The inferior surface of the cerebral hemisphere, we can see the lingual gyrus on the medial aspect of the cerebral hemisphere, and anterior to it another gyrus called parahippocampal gyrus. The parahippocampal gyrus looping here at this region, forming a structure called anthus. Lateral to the lingual and the parahippocampal gyrus, there is a sulcus called collateral sulcus. Collateral sulcus. Another sulcus here called occipitotemporal sulcus. These two gyrus, medial and lateral occipitotemporal gyrus. Here we can see on the frontal lobe, in the frontal lobe, this is an olfactory sulcus. This is the olfactory sulcus, and medial to the olfactory sulcus there is a gyrus called rectus gyrus. Rectus gyrus. Lateral to this there is structures which is called orbital gyri, which is form and H-shaped structures collectively forming structures called orbital gyri.